This information is not intended as a diagnosis or medical treatment for plantar fasciitis. If you're suffering from heel pain, please consult a physician.
I've been a walker all of my life. I can't remember not going for long, hard walks every single day. I just believe in that. I don't like a gym. I love to be outside.
A daily walk around her neighborhood is just one of the simple pleasures of Miriam Richardson's life. But not that long ago, she started having heel pain that wouldn't go away, and it became so painful that she couldn't even perform daily activities.
Everything was painful, and it was awful. It was very, very painful.
Miriam's pain grew so debilitating, she eventually sought help from a podiatrist.
He looked and he said, "You have got tendonitis. That's very common in people your age or whatever age," and he said that's just very common, no big deal. So I did what he told me to do. Then he gave me some orthotics to wear in my shoes. I cannot tell you how many pairs of shoes that I bought thinking maybe that would help, maybe this would help. I would go to the drugstore and I would buy little things that would kind of help your heel a little bit, or just anything that would help. And finally, one day, I was in a lot of pain from May until the fall. And one day, I was vacuuming my house late in the afternoon, getting ready for our Bible study, and tears were rolling down my face. And I said, I've got to do something else. There is something, I have got to do something. And I called my daughter, and she knows people, doctors and things more than I do. She said, "Oh, you just need to go see Dr. Bramlett. I'll get you an appointment right away, Mom. I think you're exactly right. I think that you're going to have to see someone that knows about this thing."
Miriam didn't have tendonitis. What she had was a condition called plantar fasciitis.
Plantar fasciitis is a common problem. We see it all the time. One of the most common things that we see in an orthopedic office. It's really important to understand that people have this problem, have very sore feet. They can't walk. When they first get out of bed in the morning, it hurts severely enough that they can't get around for the first 5 or 10 minutes. It usually warms up as they get about, and if they sit down for lunch, for example, or ride in a car, as soon as they get up, again, it hurts severely right in the heel. Some people refer to this as heel pain or bone spur pain. Commonly when they take an x-ray, it looks like a bone spur or a large ossicle of bone is grown out of the bottom of the foot. Miriam, our patient who we have, she was chronically in pain for 3 years. She'd had every alternative conservative management necessary, from injections to steroid dosing to nonsteroidals, ice, wedges, shoes. Most of these people end up with about 10 pairs of shoes which they can't wear because the heel still hurts. So she was kind of a classic candidate to go ahead and move forward with.
Miriam had reached the end of her road. Conservative treatments no longer worked, and she was facing painful surgery that has a long recovery. After meeting with Dr. Bramlett, she learned he had developed a technique that could get her back on her feet quicker and with less pain than the traditional surgery.
We've kind of developed what we thought was a new way of looking at the condition, and what we see is that it's an inflammatory process around the plantar fascia, which is the tendon of the foot on the bottom, where the heel spur originates. So over time, what we've done is evaluate and look at arthroscopic treatments on other conditions such as the shoulder, the knee, and the hip, and realized we probably could take care of this in an arthroscopic format. So what we found is by making a 2-incision technique, 2/4-inch incisions on the foot, we can take the patient, give them an anesthetic for a short period of time, approximately 10 minutes, and insert an arthroscope in and about the plantar fascia underneath the calcaneal arch and relieve the inflammation with arthroscopic debridement, much as we do an impingement release of a shoulder, a meniscectomy of a knee, or a bursectomy of a hip. By doing this, we can take off the undersurface inflammation of the calcaneus. We can go down to the spur, remove the spur in its entirety arthroscopically, maintain the integrity, which is physiologic functional for the foot to maintain the tendon, but more specifically, debride the tendon, thin it down, its fibrotic inflammatory action that's on the portion of the tendon where it comes off the heel, which is the heel spur, and by cutting it down, thinning it, arthroscopically, we've relieved the problem. Post-operatively, these people are immediately able to get up and get about. They can't full weight bear for the first day or two. Of course, any incision is going to cause some pain, but what you see is that over a short period of time, 2 to 3 days, with ice and stretching exercises, generally these people can start walking on the foot, very progressively, probably 80% faster than we would with an open incision. So this has been a good benefit to our patients.
The surgery was not hard. I was out by noon. I went in, I think at 6 o'clock in the morning. I was out by noon, came home and slept the afternoon. The next day I was tiptoeing around some. It was wonderful. It wasn't anything like I thought. And of course my foot hurt. I'm not saying it didn't hurt after the surgery, but it does take time. But by now I'm great.
And here you see the results of Dr. Bramlett's minimally invasive arthroscopic technique to treat chronic plantar fasciitis.
I'm really doing real well, and I would totally recommend it to anybody that has what I had.
Here are some symptoms you may be experiencing if you have plantar fasciitis. You feel a sharp, stabbing pain in your heel when you first get out of bed. This will usually go away after you move around a bit. You have pain in your heel if you've been standing for an extended period of time. It can also cause heel pain when standing up from sitting, and you may feel pain after physical activity. There are several treatment options for plantar fasciitis, some as simple as lifestyle changes. If you would like more information on plantar fasciitis, call Dr. Kenneth Bramlett at 205-822-9595.